privilege for me to report on an exciting randomized clinical trial that is going to be presented here at the Presidential Symposium by Frank Morschauser from Lille, international open label phase 3 randomized trial for the first time comparing a chemo-free regimen. This deals with patients with follicular lymphoma up front, so without any prior treatment, comparing a chemotherapy-free regimen with the conventional rituximab chemotherapy induction. And this is new because we have been working with precision medicine for the past 5, 6, 7 years, and it appears that a number of those new drugs, new agents, are effective in lymphoma, in particular also in follicular lymphoma. So it's a logical next step to see whether you can combine some of those relatively non-toxic precision drugs to see whether you can get away from the conventional chemotherapy with all the early and late sequelae. So what was done is to randomize, 1,030 patients, quite a number, in this global study, United States, Europe, other countries, to randomize these patients between two active non-chemotherapy agents, that's rituximab, the well-known anti-CD20 antibody, and Revlimid or lenalidomide, so it's the R² regimen, both non-chemotherapy drugs, versus rituximab chemotherapy. And the investigators were free to make a choice between R-CHOP, R-bendamustine, R-CVP, and the majority of patients in the control arm were treated with R-CHOP, about 3/4 of the patients, 1/4 with R-bendamustine, and 5% only with R-CVP. And this study was meant to see whether the chemo-free regimen would be superior, but the results of the trial are as good as I would think, and that is that there is no difference at all in terms of remission rate, complete remission rate, and progression-free survival. I can just mention some numbers. So in the R² group, the non-chemotherapy group, the CR rate was 48% versus 53% in the R-chemo group, and at a follow-up of about 3 years, the 3-year progression-free survival is 77% in the R² group and 78% in the R-chemo group. So that's not a difference at all. It's an insignificant P, and this means something. I mean, you can induce high-quality remissions that have a long-lasting duration, and of particular importance also the toxicity profiles, the difference between both arms, R-chemo versus the R². And there are significant differences, in particular in terms of grade 3-4 neutropenia, which are much more likely to occur in the R-chemo arm, 50%, versus 32% in the R² chemo-free arm. Febrile neutropenia, 7% in the R-chemo arm versus 2% in the R². And I must say that in the R² arm with lenalidomide, there were more skin rashes grade 3-4, 7% versus 1% in the R-chemo arm. So my conclusion is that there is something in the chemo-free regimens to be further developed. This is a first courageous attempt to show that it's not less effective, but less toxic in newly diagnosed patients with follicular lymphoma. And I expect next steps to be taken to further refine this model. I forgot to say that there are also rituximab maintenance in both arms, to further refine this model to see how we can maximally profit from chemo-free regimen. Think about the elderly patients that do not tolerate chemotherapy very well. This would be an excellent solution to proceed.